We are here to call on Jefferson, which owns Lehigh Valley Health, which runs the Hazleton Hospital just behind us, to warm your hearts and freeze our costs. Now, you may notice that we are not technically at the hospital. That is because we are in a parking lot just off the hospital, because Jefferson, a vice president of Jefferson, reached out to us and said, if you set foot on our campus today, we're going to arrest you. You wonder why we're asking them to warm their hearts.
Yeah.
It's exactly this, right? Because these folks who make these decisions about how much our premiums, our copays, our deductibles are going to be, are so afraid of accountability that they will not let frontline caregivers, patients, and community members come and talk to them about what they need to do. That is unacceptable.
Shame.
It is outrageous. But we're going to ask them anyway, friends. Join me in the chant. We want you to warm your heart. Join the fight. Freeze our costs. Do what's right. Warm your heart. Join the fight. Freeze our costs. Do what's right. No more hikes. No more greed. A healthcare freeze is what we need. No more hikes. No more greed. A healthcare freeze is what we need. I want to invite our first speaker up to the mic, who is an awesome leader in the healthcare movement. She is an amazing community partner in this coalition, doing all kinds of incredible work across northeastern Pennsylvania. Please welcome to the mic, Kristen Volchansky.
Woo! All right.
Thank you so much, Aaron. That was a very lovely introduction. It's a pleasure to be here today. As Aaron said, my name is Kristen Volchansky. I'm the advocacy director for Action Together NEPA. We represent a lot of members across northeastern Pennsylvania, including Hazleton and including Luzerne County, where we have a chapter. Who else here is an LVHN Jefferson patient? Anybody? Anybody in the crowd use LVHN? Yeah. So my husband and I live in Lehigh Valley outside of Bethlehem. We're about 20 minutes away from LVHN's main campus. We know that hospital well. Both my husband and I have some health challenges. We have been in that hospital a lot. In fact, if you ever need a tour guide for the Cedar Crest Hospital, I'm your girl. That said, I'm going to start with a little bit of a story because I think it really gets to the heart of what is wrong with our healthcare system. In the beginning of the summer, my husband, who has a history of kidney stones, had another kidney stone. So he sent me a text message at like noon and said, I think I'm going to make it through the day, but I don't know. So when you get the text message from your spouse, you get kind of prepared that, by the end of the day, you're headed to the ER. So he comes home from work. He's in IE. We go to the ER. They check him in very quickly. They take him out to the patient room at LVHN. And he is on the bed and he is on a different planet because he is in all types of pain. Then a lovely individual comes in our room who's just, to be fair to them, doing their job. Comes and looks at us and says, how much are you paying for the copays today? Nobody has looked at my husband other than taking his blood pressure at the front desk and his temperature. He is barely able to communicate because he's in a terrible amount of pain. And so I very nicely but firmly said, can we take care of him? And then I, his wife, am happy to step outside and give you my credit card or debit card and take care of the copay. But first, could we please just get my husband and ask him for something? And I think that in a nutshell says so much about what is wrong with the American healthcare system. When the current CEO of LVHN was hired, he was quoted in one of the local papers in the Lehigh Valley saying that he really wanted to bring his hospitality experience to healthcare. And I found that kind of odd. because when I think of healthcare, I don't think of hospitality. I'm not checking into a hotel. I'm coming to get healthcare. And for so many of our folks in our communities, in our neighborhoods, that story is way too familiar. And we fully recognize we're lucky. We can afford to even step foot in the ER. For many folks, they can't do that right now. They are struggling to decide whether or not they're going to keep their health insurance, whether they're going to drop it this year, whether they're going to delay a doctor's appointment or delay filling a prescription because they have to pay for gas to get to work, or they have to pay for childcare for their kids, or they have to cover utilities. This is a different moment that we are in. And this new moment requires more of our providers and our insurers. We have, I believe it is close to 200,000 people who have dropped their pet and health insurance, their affordable care plan this year. We have hundreds of thousands, if not millions, who are going to lose their health care when these new work requirements come into effect for medical assistance. Those people are not going to stop getting sick. They are just going to delay care until they are extremely sick, and they have no other option but just go to an emergency room and seek care that they can't afford to pay for. And that puts all of us at risk because let's not kid ourselves. If there are a ton of patients who come into an emergency room who cannot afford to pay for their care, the hospital has to either take the loss or they have to find some way to make that money up. And all of us who have insurance are then some way to make that money up. So this is not sustainable. We need more action. We need more responsibility and accountability and transparency from the providers and insurers in our area, especially in northeastern Pennsylvania, where we are far more consolidated and have far fewer options than a lot of other communities. So we are calling on insurers and providers like LVHN and Jefferson to not shut the door on their patients, on their consumers, their customers, as they would like to think of them, and to warm their hearts, open up their hearts, and freeze healthcare costs for people in our community so that people in need can get some relief.
Yeah!
So thank you, Kristen. I just want to spotlight some of the things that Kristen was saying there. We mentioned this earlier, but it is a tragedy. It is a real crisis that over 200,000 Pennsylvanians have already lost their health care just so far this year, just from Penny. And those Medicaid cuts, the largest cuts in American history, are going to be hitting us in Pennsylvania starting in October as we head into next year. And another 600,000 Pennsylvanians are expected to lose their health care. These are not just names on some kind of spreadsheet somewhere. These are people's lives. This is the quality of our lives. This is the length of our lives. The reality is when healthcare funding gets cut and when people lose care, people die. That's the truth. We anticipate the Medicaid cuts in Pennsylvania next year will contribute at least 3,000 additional preventable deaths every year in Pennsylvania, simply because people's health care is being taken away from them.
Shame.
That is unacceptable.
Shame.
That is unacceptable. And you know what? The healthcare system is not something happens over here and it happens over there and nobody notices. It doesn't matter. The reality is the healthcare system is like a pool. And when you make a puddle over here, the ripples and the waves affect everything else. The reality is that healthcare is so integrated that when almost 1 million Pennsylvanians in less than 2 years lose their coverage, that affects us all. That destabilizes the entire health insurance marketplace. It raises costs, co-pays, deductibles for all of us. And it means even more folks, even more hardworking folks, and even more families are going to go without the care they need. So we're here to say no more hikes, no more greed. A healthcare freeze is what we need. No more hikes, no more greed. A healthcare freeze is what we need. No more hikes, no more greed.
A healthcare freeze is what we need.
Hey, hey, ho, ho. Rising costs have got to go. Hey, hey. Ho, ho. Rising costs have got to go. Hey, hey. Ho, ho. Rising costs have got to go.
Hey, hey.
All right, thank you, thank you, thank you. I do want to actually. We haven't done this yet today, just because we've been rocking, and I'm standing between you and lunch. Our next thing is lunch, so we're gonna get there, friends. We're gonna cool off in the park and have some lunch in just a minute. But I did want to invite. If you're planning on speaking in Danville, don't come take the mic from me. I know we have some prepared speakers, but if anyone else here is so moved to come and share your healthcare story and your struggles and your demand. Get up here, Andrea.
Yes.
Another incredible nursing home leader.
I am Andrea. I am a nursing home worker.
Closer.
Okay. Now, okay. Thank you all. But I am a nursing home worker. And I am on the verge of, if one more increase to health care, and I will have to give up my health care insurance. I work in a nursing home. The costs are extremely high right now. And then if I add a deductible to my costs, I can't get nothing done unless I meet that deductible. My prescription, I'm paying $350 a month on because it no longer is covered by Heinrich. All right, another thing going on in my facility is many of us there decided not to take the insurance under the new rates. So I had a coworker come to me and say, Andrea, what am I going to do? I can't pay my rent with this increase coming up. And I says to her, I don't know. I don't know what you can do. But she cannot afford the insurance no longer. And there's so many of us in my nursing home alone that cannot afford the increases. The deductibles, the things that the health care does not cover. So we got to stop these people from increasing our health care.
Yeah.
We cannot afford it, especially in this day and age where healthcare workers are at risk of catching so many things. And I thank you.
Woo!
Thank you, Andrea. Thank you. Would anyone else like to come up and share? Yeah, come on. Thank you. Oh, yeah, sounds good. Hey, so my name's Elle. I'm a community organizer with Action Together NAPA. And I know that I come from a privileged place. And yet, growing up, we still couldn't really afford to go to the hospital. I had days where I would wake up and my ankle would not straighten out. I was bent like this for about half an hour until I finally limped out of it and I didn't have to cry in pain. I was working on a show, production of Godspell, when I was a senior. And I ended up having to wear a knee brace because my knee pain was so bad from the dancing. We could not go to the hospital to take care of that. I personally have not seen a doctor since 2021. I have not seen a dentist since 2021.
Shame.
And I'm very fortunate now because where I'm working, I can get health care. I still have to jump through a couple hoops with Penny to do that. But even in my position, I can't imagine how bad it really gets. And I can't imagine how, even for me at 22, how having this knee pain and having this back pain consistently is going to affect me later in life. How much am I going to have to spend? How much worse is it going to get? So this is affecting everybody. So thanks for listening.
Thanks for sharing.
Thank you, Al. Would anyone else like to take the mic? Feel so moved? Oh yeah, come on, Sean, get up here. We have another stop at Danville too, so if you're thinking about it, like I'll call you up to the mic then too.
Hello, my name is Sean Riley. I am also with Action Together NEPA. Thank you. And thank you to everyone who's been along the journey from Scranton to Wilkes-Barre, here in Hazleton, and all the folks who joined us here in Hazleton. That's awesome. I want to talk about
Hazleton Integration Project.
one thing I want to say, and obviously we have some younger folks here, so I'm going to watch my language. But the fact that we have to fight for a freeze, not even lower cost, is BS. Aaron, you've mentioned how all the folks who have lost health care and the folks who are going to lose health care. And I want you to think about that as we go through this time machine back to 2022. So in 2022, I was young enough to be on my parents' health care plan. And one thing you don't anticipate is when you're on your parents' health care plan is what happens when they die. My father, he is whose coverage I was under, he passed away unexpectedly. Unfortunately, as we found out several weeks later, the date of his death was the termination of our health insurance. So it wasn't easy, and I was tasked to step up and figure it out, because this is how it is. They don't just extend a hand. You have to figure some way out. I went to the doctors thinking that I had health insurance after his death, and I later got a bill for $27,000. I don't have that. Now, fortunately, there was coverage through Cobra, which, if anyone knows, that is really expensive. So I made the wise choice of spending $800 instead of $27,000. But I shouldn't have never had to been put in that position in the first place. So now let's take this time machine back to the present day. That is what the cost was then for someone who didn't have health insurance coverage, which is it is undoubtedly more expensive today. So think about that, all the folks who are making the tough decision and being forced off their health care if they do need coverage. Things like the covers that I need a monthly injection every month to be able just to operate, to not have allergic reactions. Do everyday folks have $27,000 laying around? I don't think so. So that's why we're here, and we're asking for a very simple ask to freeze our healthcare costs. That's not unreasonable, folks.
Thank you, Sean. Thank you. I just want to, I've been the one who's been telling you, like, today is all about the high road, friends, because we're going to these places and we're asking people to warm their hearts and freeze our rates, and we want to keep it high road. But I'm also going to say, I'm so sorry, there is a special place in hell for health insurance executives. I don't know how else to put it. I am so appalled at the stories that we're hearing, especially when I know that these stories, we're not alone. We're the ones who happen to be here today and brave enough to speak out in this moment, but there are millions of people across Pennsylvania, across our country, who are suffering. And why? Why are our healthcare costs going up? Why are our rates going up? Why? So that a couple rich people can make even more money? That's the world in which we live?
Yes, it is.
Well, you know what? I don't want to raise my baby in that world. And so I am honored to be here and to stand with you all today. And our fight is not over. And if there is anybody we got to sing this song to, yes, I'm going to make you sing that song again. But if there is anybody we got to sing that song to, it is Lehigh Valley Health. It is Jefferson Health. Because when we said we're coming to your campus, they said, you set foot on the hospital, we'll arrest you. And we said, okay, we won't come on the campus. We'll stand right here and do our speak out. But would you send someone out to meet us? We have a petition to deliver. Over 1,000 people signed this petition. Will you come out and meet us? Send somebody out to talk to us. Talk to the patients about this crisis. This is exactly what they said. There will be no meeting.
Shame!
Literally!
Shame!
Shame! So we have a song for you, Lehigh Valley Health. Because we really got to know, whose side are you on? Are you ready? Whose side are you on, Lehigh Valley? Whose side are you on? Whose side are you on, Lehigh Valley? Whose side are you on? Listen to us, patients. We're here to make this vow. We fight for all families. Freeze our care costs now. Whose side are you on, Lehigh Valley? Whose side are you on? Whose side are you on, Lehigh Valley? Whose side are you on? Insurers must take action. We're asking you to warm your heart. Freeze care costs for all of us. Stand up and do your part. Whose side are you on? Whose side are you on? Whose side are you on? I'm on the patient side. Whose side are you on? The cost of care is soaring. We all pay the price. We're gonna fight all day and night till we get it right. Whose side are you on? Whose side are you on? Whose side are you on, Lehigh Valley? Whose side are you on? And there's one other thing we got to tell them today. Because I don't think we're going to be able to deliver our petition. We are going to leave this amazing ice sculpture in the hopes that this will be a symbol and inspire them to warm their hearts.
Take the petition to the ice.
Take the petition to the ice. But I think there's one last thing we got to let them know. This fight isn't over, it is just beginning. We have a long fight ahead of us. If we can't freeze the rates this year, and I don't know that we can, it depends on these insurance companies warming their hearts, frankly. And so I don't want to promise you that we're going to win. I don't know that we can freeze rates this year. But especially if we don't, we have more work to do next year, especially when these cuts are hitting. So you know what? You know what, Lehigh Valley? We came here today, high road, giving out ice cream, inviting you to warm your heart and make the right choice. Do the right thing. But if they're not going to do the right thing, you know what? We'll be back. 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 All right, thank you. I think that wraps the speak out, but I want to make some announcements about what